Hello, this is Shruti Gupta. My designation is nursing tutor. I am working in Rama University, Kanpur. So today I am going to discuss about the disease condition. This is emphysema. This is the respiratory disorder. This type of condition happens due to the air pollution and cigarette smoking. The most common factor which is responsible for this is cigarette smoking. So first of all, this emphysema disease is also known as pink buffer. This is also called pink buffer or pink buffers. Its name is its Greek name is inflation. So first of all, we will discuss with the definition. The definition of emphysema is it is a condition in which air sacs or alveoli get damaged or ruptured, resulting shortness of breath or disturbed breathing. So this disease is progressive disease and permanent disease which causes the collapse of lungs due to the extra consumption of cigarette smoke or air pollutants. These air pollutants get collected in our respiratory tract and get effects on these alveolar sacs. So see with the help of image what happens in this disease condition. Suppose this is our alveolar sac. Alveolar sac are the terminal bronchioles. These are also known as terminal bronchioles. These are respiratory unit. So what happens here, normally when we inhale or when we exhale, it means when we take air from environment for respiration, when in normal condition, when inhalation is there, this alveolar wall has elastin proteins. Due to respiration, it get inflate or it increase this size due to the elasticity. When we inhale, the oxygen comes in and withdraws in this space. The respiration takes place. O2 get into the capillaries and CO2 get back into the alveolar sac and exhale by exhalation. So this wall helps to exhale or inhale. In inhalation, the alveolar sac get extra shaped during the inspiration. What happens in exhalation? See, in exhalation, this air is going outside of the respiratory tract. When we exhale, the CO2 is going outside of the respiratory tract with the help of nose. What happens? This wall retract and reduce their size due to the elasticity. Just like balloon, when we fill air inside the balloon get increase their size, and what happens when balloon's air comes out, its size get reduced. For example, this is the rubber band. Suppose this is our alveolar sac. This rubber band now have elasticity, so we can stretch it. It increases their size, and when we reduce their size, it come back in previous stage. But what happened in emphysema? This alveoli, just like rubber band, this thing loses their elasticity and never come back in previous stage. It happens due to this. So what happened in emphysema? This wall get shape permanently and losing the elasticity. Permanently, this is losing the elasticity and also collection of CO2. More of the CO2 is collecting here due to the loss of elasticity. The person can't exhale or inhale completely. The disturbed breathing process is here. The patient's normal breathing is disturbed, so the respiration can't be in normal stage. Next, we will see about the causes of emphysema. So first of all, cigarette smoking is the most common cause which is responsible for this disease is emphysema. I already told you that this is the progressive disease. For this disease development, it takes more time. When patient starts smoking, this is prolongation of the time patients start smoking. Smoking have nicotine product which we consume, and this dissolve in our blood vessels, flow in our blood. This affects on our alveolar sac. These walls loses their elasticity because there is a breakdown of protein. This protein is breakdown due to the nicotine consumption which is present in the cigarette smoking. So primarily, who is smoking, who is taking smoke with the cigarette, or their members is connected with this person, that can be your friend is smoking and you are sitting with him or living with him, you can also cause with this disease, affect this disease. Next is the air pollution. If someone is working on or living in the polluted area, just like factories, or working on the places there air pollution is there, so he can also affect with this type of disease. Next is infections. Several respiratory tract infections which are responsible for the inflammation and irritation of the respiratory tract and get obstructed the respiratory tract. So due to this prolonged infections can carry this disease. Since this disease prolongedly affect our lungs and also responsible for the permanent damage of the alveolar sac leading to the COPD. For the COPD, two main diseases are responsible. Which one? First one is the chronic bronchitis, and next one is the emphysema. These two diseases are responsible for the development of COPD, chronic obstructive pulmonary disease. So last one is the this is the main cause. Deficiency of the alpha A antitrypsin. This protein is responsible for the inflation and elasticity of the alveolar sac. But what happens if person having congenitally a deficiency of this disease protein? So he also can suffer with this disease called emphysema. Moving forward to pathophysiology. First of all, what happens due to an etiological factor? Suppose cigarette smoking. What happens? Due to consumption of the nicotine from the cigarette smoke, what happens in alveoli? Inflammation and damage to the walls of airway. When patient is consuming cigarette smoke or having cigarette smoking, so what happens in alveoli? Inflammation is processed, the swelling, which is the obstruction, which is causing the obstruction of the airway and also causing the damage to the walls of airway. The sacs of alveoli, which are the terminal bronchioles and respiratory unit where the exchange of gases take place. Moving forward, next, what happens in next stage? Neutrophils, these are our immune cells which are working for the neutrophils, and macrophages infiltration. These cells secrete some enzymes or juices, and also with the effect of release cytokines and elastase and protease. This is also responsible for the breakdown of elastin proteins. Elastin proteins which helps alveoli to inflate and deflate during the expiration and inspiration. What happens in emphysema? These proteins get breakdown. What happens in next stage? After that, breakdown of elastic recoil. Just like spring, it's have recoil stage. Start, be stretched from ends. It's increase its size. What happens if this spring loses this elasticity? What happens if we stretch more? It get this shape and never get back in recoil stage. This is the loss of recoil. Elastic recoil losses of the alveolar wall. What happens after that? Irreversible enlargement of air sacs. Once it have this like shape, never get back in the previous position. So alveolar sac loses their elasticity, also causing the loss of breathing and loss of respiration. Disturbed breathing is there. Lastly, what happens? Collapse of respiratory bronchioles or airway obstruction. Our airway get obstructed due to the release of mucus which get lodged into the respiratory bronchioles or the branches of the respiratory tract, which also disturbed our breathing process and respiratory process. So development of this progressive disease, emphysema. Now the alveolar sac loses their elasticity. So there is no proper exchanges of gases, no proper breathing process is there. What happens? The CO2 get collected inside this wall, and chest cavity is also increasing the size due to the collection of CO2. More CO2 is collected inside here. So what happens after this? See clinical manifestation, sign and symptoms during this condition, this disease condition. First of all, first sign will be there is dyspnea. Dyspnea is the difficulty in breathing. Patient will feel difficulty during the breathing. Weight loss is there. Person will reduce weight. Barrel chest. Barrel chest is diagnosis after the chest X-ray. Chest X-ray. What happens? The chest cavity is consuming more CO2. That CO2 is filled into the lungs and causing the chest shape in the barrel. It increases the shape of chest behind and forward both. So it's seen in the CT scan, both radiographical examination, chest X-ray and CT scan both. Next, Sputum, thick sputum. Thick sputum production will be there, which lodges inside the respiratory tract. Next is the cyanosis. Lips and nails will be shown in the blue colors. Next is anorexia. Anorexia is the loss of sleep. Patient can't sleep properly due to the obstruction in airway and dyspnea. Next is fatigue and also decrease O2 saturation. If we assess with the help of ABGs or O2 pulse oximetry, the O2 saturation will be decreases due to the disturbed breathing process and respiratory process. Next is diagnosis. What diagnosis will be used to diagnose emphysema? So first one is chest X-ray and CT scan. These both are radiographical examination which helps to diagnose emphysema. The chest portion can be seen by the radiographical examination. Next is ABGs, arterial blood gases. ABG analysis is also helpful to use to diagnose the blood gases, which are CO2 and O2 respectively. What happens? Hypoxemia is there and hypercapnia is there. Hypoxemia is the lack of oxygen saturation in the blood, and increase of the CO2 is known as hypercapnia. These are helpful for the diagnosis of level of O2 and CO2. Next is the sputum culture. This is done for the infection, to diagnose for the infection. If an infection is there, so we can diagnose with the help of sputum culture what infection is there. Next is the pulse oximetry. This is also used for the detection of O2 saturation. Next is PFT, pulmonary function test. This includes spirometry and next is lung volumes. These diagnosis tests help to diagnose the emphysema. Next, moving forward to management of emphysema, first one is including drugs or pharmacological management. So first of all, pulmonologists will suggest smoking cessation because main cause is smoking for emphysema. We will counsel the patient by the pulmonary rehabilitation process. Patient will come for the rehabilitation and counseling process. The pulmonologist will suggest a patient to and his family for the smoking cessation. Stop smoking uses for the rehabilitation of the disease. Next is O2 therapy. We have to maintain O2 saturation of the body by the administration of the O2. Next is bronchodilators. These bronchodilatory drugs are help to dilate the bronchial or respiratory tract, which will help to widen the respiratory tract. If we provide this type of drugs, this increase the passageway for the airway, inhale and exhalation. So inside and outside air can be moved very easily if we provide this type of drugs, because this helps to dilate the bronchioles. Next is the postural drainage. This process is used to drain the content of lungs from inside to outside with the help of tube. Next is steroids. These are helpful to reduce the inflammation. Corticosteroids drugs which used to for the inflammation. Next is the chest percussion. Chest percussion therapy is used by the physiotherapist, which is used as a cup-like hands with tap on the chest, which will help to liquefy the chest secretions and also increase the blood circulation inside the chest, and patient can breathe easily. Next is the surgical management. This is the last management. If for emphysema there is a not permanent cure or permanent management, but we can help patient to reduce their symptoms. Symptomatically, we will manage the disease by the drugs and other therapies. The pulmonologist suggests patient for the pulmonary rehabilitation. He will stop smoking. He will start some healthy habits. Nutrition also there, and also he can start breathing exercises by the help of nursing counseling and pulmonologist suggestions. Next is the surgical management. So first surgery is the lung volume reduction. We reduce the lung volume and surgical procedure which will reduce the damaged alveoli or damaged part. With the help of surgery, this will remove by the surgery. Next is the lung transplantation. This is the last surgical management. If no treatment can be cured the emphysema, so last one is option there is a lung transplantation. We transplant lung or from the donor's lungs, exchange lungs from the recipient. So that's all. Thank you.